How to use Kinesio Tape to help patients with long COVID. Hi, I'm Dr. Michael Lee, certified Kinesio Taping instructor here in the UK. Thank you so much for checking in, whether you are a physiotherapist, chiropractor, osteopath, sports therapist, or even a doctor, because you're probably thinking that although you've come in for, you may see patients with long COVID, the answer may surprise you. Because if you think about these patients that actually have long COVID, these are the ones that are like got chronic fatigue, they can't get themselves out of bed, they're having breathing difficulties, but are getting all these COVID symptoms many weeks and months after when they contracted COVID-19. But ultimately, the virus isn't there anymore. But the question is, why do they have the symptoms? Because, you know, they get tested, they do COVID tests, and actually they're negative. But they're still getting all of these symptoms of having chronic fatigue, having bodily pains, having difficulty breathing, right? And all these things affect their lives, because we've seen so many patients that have had long COVID that they've actually had to stop working. And they're actually very similar to patients who have ME, or we say chronic fatigue, right? And essentially, their whole life is being put on hold. So the question now is, what can we do to help these patients who have long COVID? But most importantly, how can we use Kinesio Tape as the tool to help these patients with long COVID? Because this whole month is actually all about how do we actually help people with breathing difficulties, right? Because I know last week we spoke about patients with difficulty breathing. Today was about long COVID. Next week is going to be about patients with cystic fibrosis. But ultimately, there's something about Kinesio Tape that can actually benefit these patients. And you're probably thinking, how and what? Let's start with the what, right? Because what is Kinesio Tape? So essentially, Kinesio Tape, if applied correctly, how Dr. Kenzo Kasei, the inventor, actually intended it to be applied, it will then lift. It creates a lifting effect. So it creates space beneath the soft tissue. So if it's creating space, yes, fluids can move better, muscles can contract better, fascia can move better, and of course things just move better when there's more space, right? Because just think about when things are compressed, they're compressed with a lot of force, things don't move very well. But also, ultimately, nutrition doesn't get to the area very well, and actually patients then have more pain, because remember, pain receptors, or your nociceptors, are essentially pressure receptors. The more pressure that's applied, the more pain a patient will actually experience. But the real question here is, if there are no structural issues or viral issues here with long COVID, why are they having these symptoms? So we have to always need to be looking a bit deeper now in terms of, if these symptoms are around but there's no virus around, who has created it then? Excuse me, who's created it? The patient had to have created the symptoms, right? And we're not saying that the patient is mad, but usually the brain, the part of the brain, the basal ganglia, which remembers all of our traumas, would then create a protective mechanism against the trauma of having COVID. And that's what tends to happen. That's why they get these symptoms of COVID, right? Because remember, the brain doesn't create symptoms because it's got nothing better to do. Or it's like, oh yeah, you know, I'm really bored today, I'm going to create my long COVID symptoms so I can go and do nothing. Because just think about it. If you could give the patient the option and the opportunity to go and do whatever they want and not have COVID and long COVID symptoms, what do you think they'll choose? Of course they'll choose to do what they want. But the question is, why are they actually experiencing these symptoms? And that's why we need to look at the why. So of course, from the pattern that I see as an instructor here is that, yes, we see that they are constantly in fight or flight. When you look at them and you look at their sleeping patterns, and they're usually, or they're always sweating and they're always short of breath, usually it's because their adrenal glands are actually working really hard. Not necessarily saying they're in adrenal fatigue, but what I'm saying is, if they are in adrenal fatigue, what tends to happen, and we see these in scans sometimes, is that you see the kidney. Sometimes the adrenal gland can actually grow the same size of the kidney, so it sits on top, and then it impacts where the lungs are above it, so the lungs can't expand so much. That's why they get short of breath. But I'm not saying that that is actually with all long COVID patients. It can just be with some of them. But when we see those that have are in fight or flight, the question is, how do we calm down the adrenal glands? And also, if they've got shortness of breath, how do we apply tape to expand their lungs? Because just think about it now. What are the main muscles that help with breathing? First one is diaphragm. Second one is, of course, your intercostals, right? And the tertiary, I guess, or every supporting muscle that's around, whether it's pecs, whether it's rhomboids, whether it's trapezius, whether it's all these different muscles surrounding the rib cage, right? Those are just the tertiary muscles. But essentially, we need to make sure they're not all bracing, they're not all contracting. That's creating a vice around the ribs. If there's a vice around the ribs, of course, it isn't going to expand, because remember, when you have hypertonic muscles are the ones that are bracing, that cannot let go. When they're bracing, of course, that's what's going to happen. It's going to be a vice around the rib cage, and then they can't expand. So these are the assessments we need to actually be testing first. Let's find out what muscles are overworking or what muscles are actually bracing, because as soon as we know what's bracing, then we apply the inhibition application of taping to then calm it down so it's not bracing so much. Then if it's not bracing, it's going to create the space. And when it creates the space, then it can expand. But then the next question is that, so how do we calm down the adrenal glands? So I remember I was at a conference with Dr. Kinesio Tape in Hawaii, and I loved what he was teaching about insomnia, actually. And you're probably thinking, what's this got to do with long COVID? Well, the reason why I was talking about insomnia is I was asking about who has difficulty sleeping, and he asked the whole room, and someone actually raised their hand. It's okay, right? We're going to tape you, and then we'll see if it affects your insomnia. What he did was he taped the fingernails with Kinesio Tape, and Dr. Kinesio Tape's theory was this: the fingernails are there to attack or defend, right? Just like any other mammal, and of course, to attack or defend is the fight or flight response. And the question was, what if we taped it to calm down the neurological input towards the adrenal glands? Would it then, which would tone down the fight or flight response, would it then allow someone to sleep better? So this is the thing. If we can, then of course, tone down the adrenal system, it may actually allow them to breathe better too. So this could be one thing to test. I'm not saying it's going to work for you, because I haven't assessed your patients, but essentially we will be testing how can we calm down their fight or flight response. The other thing we'll be actually thinking here is, why did he have those symptoms? And we're thinking neurologically here. A lot of these dysfunctions, particularly if they're chronic, they're generally more neurological than structural. That's why we actually do neurological testing, to really find out what nerves are working, what are not working, and then allow the tape and how it's been applied to correct those neurological dysfunctions too. Very hard for me to show you online here, but in our live courses, we do actually do workshops and show, actually, we're going to test this muscle, we're going to see that it's hypertonic, it's bracing, it doesn't let go, we're going to put tape on it, then it goes weak. Okay, so we know how to actually change things with tape. Or we might find a weak muscle, put tape on it in a certain direction and the right tension, then it goes strong. Question why? It's not that we're taking it to the gym, we're just changing the neurological input. And we can do this for long COVID patients as well. But sometimes they may be so shut down from long COVID, by the way, we may need to apply something called functional correction. So we may tape them at high tension to then physically allow it to expand without their muscles even working. And that's also possible too. I'll generally say functional correction is one of the best ones to use, particularly for those who struggle the most. But essentially, we need to be thinking, how do we get rid of these symptoms? We need to make sure we're not treating symptoms, we're treating the causes. Because if we can do that, then we'll be truly serving the patient in the long term, not just in the short term. So I really hope that you found this live session really helpful. If you have any questions, put them in the comments. But if you are interested, we do have a Kinesio Fundamentals live session course happening in December. It's not long until we're going to do this, where we'll be giving you all of the fundamental applications, how Dr. Kinesio Tape, the inventor, has actually invented it to and intended it to be used. If you would like to use Kinesio Tape as a tool with your patient, especially how the inventor actually asked you to do it, then of course, please let me know. Put me in the chat, and one of our team will give you some very special gifts to accelerate your learning, to make sure that you are ready to go for that course itself. So thank you so much for joining me today. Please do like this video if you find it helpful, and please do share it to other clinicians that may find this beneficial too. On that, thank you so much for joining me. On that, have a lovely week, and I look forward to seeing you next week for the next live every week. Bye for now.